The squat therapy consists of 3 mobility exercises. First, we're going to be spreading both knees apart for more external rotation. Then we're going to focus on just one knee at a time. And then we're going to focus on some thoracic mobility. Now, there are different modifications to each of the exercises depending on your mobility and kind of where you're feeling. So the beginning variation is just going to be to do a deep squat. So I'm going to drop into the bottom of the movement. Now, if this movement feels pretty inaccessible, where you can't get to this movement without having lots of tension, or you're getting to right about here, sometimes sitting on something to bring you to a level that's more comfortable for you can be really helpful. You can either use a yoga block or you can use a box. So find the level of depth that feels best for you. After you find your level of depth, we're also going to focus on the ankle mobility aspect. So if you're getting into the bottom of the movement and we're right around here and it's feeling really uncomfortable, sometimes, again, finding the level of depth that works best for you can help you find a better ankle position, or we can either put something underneath the heels, such as like a rolled up yoga mat or like a wedge to help support the bottom of the heels. To start the movement, we're going to spread both knees apart. So you're just going to drive the elbows into the side of the leg and spread apart. You'll do about 5 to 10 of these. After you do both knees spreading apart, we're just going to do one leg at a time. So I'm going to anchor one arm here, and then either using the other hand or the other elbow, I'm going to push the other leg out and then back in. So 5 to 10 sides on this side, and then switch, anchor the arm, 5 to 10 sides on this side. After that, we have thoracic mobility, and we have a few different variations of it. First, you can just put the hand down on the floor and then open up, and then back down, open up. Some folks find that they start to lose balance where they get to here and they want to fall backwards. This is where holding onto something in front of you could be helpful, such as like a door frame or a squat rack. So I'm holding here to help keep my body position. And then instead of opening upwards, I'm just going to open outwards. So I still have the thoracic mobility that's happening in this position where my lumbar spine is locked down. So deep squat positions are going to prevent our lower back from rotating because we want most of the rotation to be in the upper back. If we want to advance this even more, we can add a weight to it. So I can start here, put my hand either down on the floor or down on a yoga block if I feel like I can't quite reach the floor. And then I'm going to press the weight up as I open and then back down. So come to face forward, open to feel that thoracic mobility. And then same thing here. If I'm finding that I'm falling backwards, but I want the advanced variation, I can hold lower on the door frame or the squat rack. I'm here, and then I'm opening up for that same thoracic mobility opening, but now I have a little bit more of a demand, a little bit more of a loading. So for the squat therapy, we have 3 main movements, spreading both knees apart, just one knee apart, and then we're going to be doing some sort of variation of thoracic mobility.